All right, ladies and gentlemen, welcome aboard. Joining me now is Sally Pipes, president of the Pacific Research Institute, healthcare policy expert, and author of The Way Out of Obamacare. And of course, the big news, Sally, as I welcome you, thank you for coming.
Thank you, Steve.
Is that the House voted by the skin of its teeth, 20 Republicans voting no, but the House has finally voted to repeal, replace Obamacare.
Right.
There's been a lot of criticism from the left, Nancy Pelosi, demagogued it without mercy today. What's your impression of this bill as it stands now, knowing that going forward it'll probably be changed a million times?
Right. Well, Steve, as you know, Obamacare turned 7 on March 23rd, and then there on March 24th, Paul Ryan pulled the bill. They didn't think they had the votes, and so we've seen a lot of toing and froing about how to make it more amenable to members of the House, and they brought in these the moderate Tom MacArthur, the moderate member of the Tuesday group, brought in these 2 amendments allowing states to apply for waivers to opt out of the essential benefit plan and community rating. So, and then of course yesterday, Fred Upton, a moderate Republican, brought in his $8 billion over 5 years to help.
The Upton Amendment.
The Upton Amendment, yes, to help those people who supposedly had pre-existing conditions who didn't keep their continuous coverage, so that would help them.
And we should point out, the media, I think, is misrepresented. It's not just $8 billion over 5 years for the entire pre-existing condition pool. It's an additional $8 billion to what I think they put 100 and something.
130 billion over 10
years.
Yeah.
So it's another 8. It's not like it's only 8. But
no, it's 130 billion plus 8, and of course that's a lot of money. So the interesting thing will be, what is going to happen if this bill has just, of course, the American Health Care Act passed the House. What's going to happen at the Senate, because the Congressional Budget Office hasn't costed out what this bill looks like.
Right.
And the Senate, the Republicans have 52 members. Are they going to be able to, are they going to adopt this? Are they going to change it a lot? I mean, I think, I really wanted the House to have a bill. I didn't want these state waivers because, let's face it, not all states are going to apply for the waivers. California and New York, for sure, are not going to. Mm-hmm. And then what happens when there's a change in the administration? You'll see this new administration will say, well, we're not going to allow HHS to approve these waivers, or they're going to discontinue them. So then what I would have preferred to see in the House bill, making the changes that are permanent at the federal level and not doing these special waivers.
And how would that have come about? How would they have made that couldn't be changed, like you say? It's up to the HHS to approve waivers
for over 10 years.
Right.
They're 10-year waivers.
Right.
But I think that the issue is that we should have, in Tom Price's Empowering Patients First Act and Paul Ryan's A Better Way, which were in 2015. Those were very good replacement plans, and that they would have, got rid of the essential health benefit plan. They would have, made, provided the age-based refundable tax credit, expanded the amount you could put in your health savings account, change, the expansion of the Medicaid program so that wouldn't continue.
Right.
And I think it would have been much better, because I'm very nervous of, these waivers and what's going to happen. I do agree states should have more power over how they spend their money, but and on Medicaid, the idea of block granting the states is a good idea. But these waivers on the essential health benefit plan and community rating, where if you get a waiver, you could only get a waiver if your state has a high-risk pool, and we've talked about that, 130 billion over 10 years.
Well, let's talk about seniors before we even talk about high-risk people. They're saying the AARP is running ads, and I know they're politically motivated to an extent. I believe they are,
right.
But they were in favor of Obamacare at the beginning. But having said that, they say that there's an age tax basically, and that if you're over 50 or over 45, your premiums are going to go up tremendously. I mean, is this true? Are you concerned about that?
Well, no, I'm not. I mean, the age-based refundable tax credit for people 50 to 64 was upped, to $4,000, and then there's a limit. Interestingly, a lot of the people in that 50 to 64 age bracket are people at their peak earning years. So it was interesting that they said these people aren't going to be able to afford coverage. Plus, Steve, 160 million Americans have employer-based coverage. So if these people have pre-existing conditions, in many cases they won't leave their job because they do have coverage. We're talking about a very small number of people with pre-existing conditions. So I think, the AARP is very political, and of course they don't want to get rid of Obamacare. And the people in America voted to repeal and replace Obamacare. President Trump, I think he won, a couple of weeks in Valley Forge before the election. He said, we are going to repeal and replace disastrous Obamacare. And we've had a couple of false starts. I don't think it had to be done in 100 days. We needed a bill that is actually going to repeal and replace Obamacare.
And we kind of have that. So what kind of bill do you think we will eventually see? What kind of changes to the House bill as it stands now? Where will those changes be, most severe when it gets to the Senate, do you believe? And then eventually back to conference.
Right. So if you look back at Obamacare, remember, not a single Republican voted for the law. But when it came out of the House, and Nancy Pelosi was the Speaker of the House at the time, and it went to the Senate, a lot of the things that the House wanted, like the public option, whether it be in a government-run insurance plan competing against private insurers, that was stripped out. They stripped out quite a bit. So I'll be interested to see what the Senate might do to this, because they're going to have to get 51 votes to pass the American Health Care Act. And I think the CBO is probably going to cost it out before it comes out. And I think the way this looks to me, it's going to be a lot more expensive. How are we going to make some of these amendments through budget reconciliation? It's not going to work. So I think they're going to have to make some serious changes to the American Health Care Act. But the age-based refundable tax credits are good, because they're going to get rid of the Medicaid expansion. They're going to get rid of the subsidies. They're going to get rid of the employer and the individual mandate. I didn't like them slipping in on the AHCA that 30% subsidy that people who didn't keep their coverage were going to have to pay.
That means instead of paying a tax to the government, the insurance company will charge you 30% more if you had lapsed for over 60 days, and that's 60 some odd days.
66 days.
Yeah, and then you're going to have to pay basically a bonus to the insurance company.
Right, exactly. And so that doesn't really in my mind, get rid of the individual mandate, because it's another mandate giving insurance companies that extra money for what they're doing. So we'll have to see. But I like the idea of the health savings accounts almost doubling the amount you can put away. I like the idea of block granting under Medicaid. The 15 to 20 million people who have joined Medicaid under the Obamacare. We now have 76 million people on Medicaid. Wow. That's double the population of Canada. And a lot of these people, while they have coverage, they can't actually get a doctor, because doctors don't want to take these people because of low reimbursement rates, or they're told you have to wait and wait and wait. What good is having, a care card or coverage that you can't use? And the people that have got the income-based subsidies under Obamacare, many of them can't afford to use their coverage when you have a deductible, $12,000 for a family. How many people have spare?
The Wall Street Journal said today, and I've heard two congressmen, including Kevin McCarthy, deny it, said that employers can now give policies that would do away with the lifetime limit, with an endless lifetime limit, and would do away with the out-of-pocket expense limit as well. And he said it's not true. From what you've seen, what do you believe?
Well, I hope that it's not true. But I also think that I never liked the saying there's no limit on what your amount could be, no limits and lifetime caps. I think that's wrong. If I want a plan that covers absolutely everything, I should be able to pay for it. You may not want that, but it would be cheaper if you want a more stripped down plan that is a cap of $1 million.
So it should be free market.
It should be market based, absolutely. Yeah. And so there's a lot of government still. We haven't got a real repeal and replacement plan that I wanted to see. But maybe at the Senate, maybe, Steve, things will take place and they'll be able to get something through. President Trump has promised it. The Republicans are very nervous. They've become kind of scattered, and they're dealing with the moderates versus the more conservative members of the House.
Right. Yeah. No, that split, and Donald Trump somehow was able to, by the skin of their teeth, get them together, I guess. And one more question. This was imperative because Obamacare was a mess, is a mess. You have states where there's Aetna dropped out of Virginia yesterday,
right. And United too.
United, and I think there's a couple of states where there's basically no insurers left, and it was headed for disaster.
Right, exactly. So Virginia, it looks like they'll have one insurer in 2018, which is Care First, Blue Cross Blue Shield. And so this is not opening up the market and giving people options. People want to have options. When the CBO said 20 million people are going to lose their coverage, a lot of those people, if the essential benefit plan went away, insurers would bring out new types of plans
Right.
that would be suitable to people. And so many people would not be out of, without coverage. They'd get a plan that suits and works for them. The other thing is these cost-sharing reduction plan, where the insurers are, they've been getting $7 billion a year,
Right.
and so to cover lower income people.
Right.
And so that, I hope, Mr. Trump said the other day that he's going to allow those subsidies to continue for now. I actually think they should not. Those were illegal in the first place, and they never should have been allowed to be paid out.
We shall see. Sally, nobody knows more about this than you. And of course, you wrote the book, The Way Out of Obamacare.
Yes.
And I hope they all read it because they're finding their way out of Obamacare.
Right.
Good to talk to you.
Good to talk to you too, Steve.